In the United States, there are screening recommendations that apply to everybody, but not everybody really needs to be screened the same way. Your family history is a big part of learning your risk and personalizing your medical care plan, helping you stay healthy. Now my favorite lesson, collecting your family history. Collecting your family history involves gathering information about the health conditions and medical history of close family members. This information is crucial and can provide valuable insights into your risk for developing certain medical conditions. It also helps your healthcare providers make more informed decisions about any screening, prevention, or treatment they recommend for you. So here are some steps for collecting your family health history. I've included a PDF that you can use when you're talking to your family members. You want to start by identifying the family members that you need to include in your family health history. This should be your parents, siblings, grandparents, grandchildren, aunts, uncles, nieces, nephews, and cousins. These are people who are biologically related to you. Of course, you can record people who may not be, whether they were adopted into your family or their step relatives, because sometimes that information is helpful when we talk about exposure risks. But usually when we're talking about family history in terms of genetics, we're really focusing on biological relatives. Now, in the PDF, I'll also provide a list of conditions that you can ask your relatives about and make sure to record. You should record any information on any medical conditions, including the condition name, the age of diagnosis, any treatments, surgeries, hospitalizations, and any significant health events of each relative. If a relative is deceased, you'll want to record what their cause of death was and how old they were when they passed away. And for those who are living, you'll want to record their current age. And it helps to add a birth date because then that age can change as the pedigree ages. So when's the best time to collect it? Only you know your true family dynamics, and every family is different. But something that I suggest is scheduling some sort of family meeting or phone call. This can be one-on-one with each relative, or it can be as a group if you're all very close and share information openly. You also want to let them know that you're collecting this information for your own health, because sometimes that makes them a little more willing to share information. You can also offer them the information for their own health records. You can set up a phone call or an in-person meeting or Zoom to discuss the family health history. This can be an opportunity to gather information from multiple family members at once and ensure that everyone is on the same page. You may need to schedule separate calls or ask them questions in a written form like an email or a text message, and that's okay too. You can also use family holidays. For instance, Thanksgiving is actually National Family Health History Day because it is a time when so many American families gather together. Make sure you record the information in a questionnaire or a list, including the name of each family member or initials, the medical condition, the age of diagnosis, and any other relevant details. It's also important to keep this family history information up to date as new medical conditions or events arise in your family, whether there's births, deaths, or new diagnoses. And the last step is to share your family health history with your healthcare providers, especially primary care. This can help in making the best recommended screening, prevention, and treatment decisions for you and being proactive about your own healthcare. In the United States, there are screening recommendations that apply to everybody, but not everybody really needs to be screened the same way. Some people need to be screened earlier and more frequently, and some people need to be screened later and less often. Your family history is a big part of learning your risk and personalizing your medical care plan, helping you stay healthy. Now, as a genetic counselor, I absolutely understand that there are exceptions to this. Not everyone knows their family history, and there's a lot of reasons. Whether you're adopted, you're conceived by donor egg or sperm and you don't have that health history, your family doesn't talk about health issues or maybe wasn't offered good medical care or didn't go to the doctor, or in your culture, people just don't talk about medical issues. All of these are actually quite common. So we can use other data points to help you understand your risk as well. You can ask a genetic counselor about proactive medical genetic testing. And that's not your 23andMe, that's not your Ancestry DNA. This is actually medical testing that uses medical grade sequencing and deletion duplication technology to determine if you have one of the most common conditions that we see in the population. And this does not require you to have a family history of anything. So I recommend it for my patients. Now, it's okay if you can't collect your entire family history. Just provide what you can and give that to your providers. Again, if your family members seem to be hesitant or they don't want to share information, let them know that their health history can help inform your care. So you're doing this to stay healthy for yourself or maybe even for their children. And typically that helps people feel more comfortable about sharing that information.